Hello and welcome back to the Patient First Podcast. I'm your host, Dr. Bryan Laskin, where I'm looking to increase the influence of today's engaged dentists. Today I have a little bit of a cold, so my voice might crack. I might be a little froggy, but I'm here and I'm engaged just like you because we have to help you out. I'm looking to help out practices around the country. It's really what I love doing today. And today I want to focus on what I believe to be most people's biggest barrier to success. And it's something that I've had a lot of insight into my entire career. My entire career, I've been focused really on dental innovation. And innovation really means one thing. It means change. It means trying to do things better tomorrow than you did yesterday. And I've worked both with some of actually the largest companies in the world in innovation. And then within my own companies, we've focused on specific innovations too, and really just trying to make things better. And we all have the same barrier. All of the people in dentistry who are trying to make the world of dentistry tomorrow better than it is yesterday. And that biggest barrier is inertia. Inertia is really what keeps people doing the same things over and over again. And it's huge in dentistry because we're all busy. And anytime you make a change, it's going to slow you down. Even if that change is better in absolutely every single way. If you go from film x-rays to digital x-rays, if you've made that transition in your career, you probably know that it was hard at first. You had to slow down. How do I actually do this? It's better in every way, absolutely every single way. There's nobody could convince me, and they've tried, that film x-rays are better than digital x-rays. However, there's still about 10% of dentists that are using film because they are the immovable object. They're trying to convince themselves that there is value in using films. There's not, but they're convincing themselves of that because they don't want to do the change, because there's an adage that says change is hard. And like most cliches, it's true. Change is hard, especially for those of you who have made a change and then been burned. And then you go, I'm not going to do that again, right? You get afraid, you pull back. You don't want to make the next change because you got hurt by the last one. Well, ask the people who ran the companies, Blockbuster, Kmart, or Polaroid, right? They didn't want to change because that change was hard. But if you ask them, they'll tell you one thing: pain of not changing is greater than the pain of change. Change is hard, but not changing is harder. So you get to pick your pain, so to speak. Take example, your website, which is really what led me to create this podcast, because I'm out there talking about websites all the time, because at Tooth Apps, which is my fully integrated platform where we're bringing on different people's applications. It's like an app store for dentistry. Tip of the spear for Tooth Apps is your website, because I feel that you shouldn't have to go to your website provider to add something like paperless forms or paperless payments to your website. Just click a button and it shows up. And that's what we're doing at Tooth Apps. And when I talk to dentists, 85% of dentists don't have the technology on their website that they know they need to attract patients, that patients are asking them for every single day. 85% of dentists don't have the things that like Starbucks has on their website, on their practice website, to communicate with patients. And 85% of the dentists that don't have that, 100% of them know they don't have that technology. So I asked them, why have you continued to have your website be from the year 2000 and not updated it with all the technology that you need today? And it's always the same answer. It's that it's just hard to make a change. We have to call the website provider. It's a big pain in the butt. So what we're doing is we're actually giving people free websites. If you want to learn more, go to toothapps.com, toothapps.com. It's a great platform. It's taken off like crazy. But our biggest problem is the same problem as every technology company in the industry, and that is breaking the inertia of what you did yesterday to tomorrow. To help people find you online, to pay their bills online, schedule appointments online, is a hard change for people because it's change, not because that change particularly is hard, because we're doing all the work. We'll even take your exact website, rebuild it the exact same way, which probably you want to improve it, I would guess, but put all the technology that you need on it for free, right? But it's still hard for people to make that leap because they have to go, well, it's gonna slow me down. Slowing down to speed up is one of the greatest things you can do for your practice. Absolutely. We talk about that all the time on this podcast, but I recognize that that is hard. And I talk to people every day that not changing is harder, especially right now. And that's another cliche that's true, because coming out of the pandemic, everybody's looking for you to change. If you think about just 2 years ago, what you're doing in your practice, if you hadn't made any changes over the last 2 years, chances are you would be a lot smaller. And if that's you, if your practice is a lot smaller than it was 2 years ago, it's because you haven't adapted to what's gone on in the world, and the world has changed fundamentally over the last couple of years. So these are the changes to make. And the way that we at Upgrade Dental filter whether or not the change is going to be worth it before you go into it, because you know it's going to be hard. Whatever you do, whatever you decide to do, even if you change your burr from this burr to that burr, you know that that is going to require thinking, calories, slowing down to speed up in the future. Any change is hard. So, how do we know if the change is going to be worth it? Well, we run it through what we call the cost of implementing filter. The cost of implementing filter is an acronym. It stands for C is clinical quality. So does this improve or not improve your clinical quality? Three options. It can make it better, it can make it worse, or it can stay the same. That's it, right? O is observation by patients, or how the patients perceive the patient experience. How is that affected by this new technology, this new procedure, whatever you're looking to implement or change in your practice? S is a dollar sign for ROI. So does this improve your profit? Does this decrease your profit, or does it stay about the same? And T is team health. So clinical quality, patient experience or observations by patients, ROI, and team health. Now, the way I like to look at the cost of implementation filter, the first two are like a light switch. They're on or off and non-negotiable. So what that means is that if this does not improve the clinical quality that we're going to provide our patients, it's a hard no. If it negatively affects the quality at my practice, it is a hard no. We will not implement that. If it's yes, then we move on to the next one. Observations by patients. How will patients observe this new technology, this new procedure? Again, if it's better, then it's moving on. If it's no, if it's not, if it doesn't improve clinical quality and it doesn't improve the patient experience, I am not going to make the change. Okay. A lot of people are looking at other technology procedures and not thinking about this. It can be a quick way to say no to something. If you're not clear that this is going to improve if it has the risk of decreasing clinical quality or the risk of decreasing the patient experience, it is a no. Okay. But if it's a yes to both of those, then we move on to ROI and team health. And ROI and team health are more gray. That's like, that's where you have to burn some calories and think about it a little bit. Because oftentimes, as I said, every time you make a change, it's going to be hard. So it's going to slow you down. So by definition, most of the time, not all of the time, but most of the time, your ROI might be going down at first to go back up. And it might skyrocket even after a day of trial. But oftentimes it may take effort by your team. So your team might suffer a little bit because they have to do some additional training. They have to think, not versus yesterday, they didn't have to think about what they were doing because they did it for the last 10 years. But if you make a change, they have to think tomorrow. It decreases your team health. So team health, ROI, you have to think about it a little bit. But if it's going to increase your ROI, if it's going to increase your team health over time, and it's going to increase your clinical quality and the way your patients see your practice, then it's going to be worth it. And you have to kind of have that in your mind as you go forward through the change to help break that big enemy to your barrier for success, which is inertia. The inertia of being the immovable object. Do not look to others to be an irresistible force to break you out of your inertia. You should be constantly looking for ways to becoming better and not implementing all of them, but running everything through this filter, the cost of implementation filter, so that you can see what is the size of the prize at the other end of this change that we're looking for. And is it worth putting my team through the training to get there? That's what we're trying to do with Tooth Apps is we're building a website for people for free right now because we're trying to get people to realize we're trying to be the irresistible force to attract the immovable object, but not everybody's going to do that. And so the more you can be open to change, I believe, the more successful you'll be. Now, keep in mind that you want to evaluate things as you go forward because your viewpoint on the cost of implementation features may change over time. You might see something else. So constantly being on the lookout for how you can do things better is the opposite of the immovable object. And so I just wanted to present that because I do feel as I talk to there's some great innovators in dentistry who are doing great things. And I talk with them, and everybody has the same issue. And it's trying to convince people to make a change. And I think that that is why dentistry is far behind in some cases. Things like the restaurant industry or the hotel industry, and patients are suffering and practices are suffering. And so I think the more that we can be adept at looking and evaluating what changes make the most sense, and then be adept at implementing those changes, the better off we will all be. And of course, I put together the Insanely Productive Dentist Workshop series to help people evaluate and implement change, but also just how to massively grow your practice. I think that people have reached out to me about IPD, we call it, the Insanely Productive Dentist series, and they're asking about, their questions are about incremental growth. IPD is not about incremental growth. IPD is about explosive growth. And so if you're interested in doing the change, the work to have explosive growth, I'd recommend you go to upgradedental.com/go. Thank you very much. It's been great, as always, doing this podcast for you, even though I have a cold. And I look very much forward to talking with you in the next Patient First podcast.